Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society produced by HCPLive. In today's episode, we are featuring Dr. Noreen Galaria, a board certified dermatologist who is an active member of the Skin of Color Society's Scientific Meetings Committee. So, welcome, Dr. Galaria. Please tell us a little bit about yourself and what you've been doing.
Thank you so much for having me. I appreciate it. Yeah, like you said, I'm a board certified dermatologist. I've been in practice, wow, almost like 22 years.
Wow.
And I initially, after training, moved to the University of Utah, and I was an assistant professor there for some time. And I think that's where I really kind of became interested in this intersection of allopathic and naturopathic treatments for skin health and aging. And so I started doing some research on these natural remedies and then eventually moved into Northern Virginia. And I've been here for about 15 years. We have three offices here. And, after some research, I eventually started a line of nutraceuticals called Inner Glow.
That's excellent. Okay, great to hear. Thank you. And okay, so now let's delve in a little bit into your journey into dermatology and how you kind of got it all started. First, could you please tell us what drew you into the field in the first place?
So I think like so many other dermatologists, I love how visual and immediate dermatology is, right? Like somebody can walk in and I can see them, I can diagnose them, I can treat them all in the same visit. And I think that as a physician, that's incredibly satisfying. But what really became my passion was this intersection of conventional medicine, like what we learn in dermatology, and how to really marry that with natural medicine. So, as the years went on, I became really very interested in this natural approach, where I love treating chronic disease with the rigor of medicine, but then also recognizing that things like inflammation, oxidative stress, maybe barrier health are, they're influenced by what patients are doing internally. And that's where sometimes the natural interventions can be incredibly powerful. And so that I think is where a lot of my interest lies. And then, the second part of this, which I think is very relevant to our discussion here for the Skin of Color Savvy podcast, is that I had started my training in Philadelphia and New York, and then I moved to Utah. And sometimes you don't actually realize what you have until you don't have it anymore. And so when I was, in Philly and in New York, I was seeing all skin types every single day. And then in Utah, 90% of my patients were Caucasian. That's kind of the population there. And I realized I was training residents that sometimes would have seen like just a handful of patients of color even when they were graduating. And so I think it's the first time that I really started to realize that representation mattered to me.
What would you say are some of the rewards then of working in this specialty, and what are some of the greatest challenges you face?
So, I think a kind of a broad reward, right, is just the impact you can have on someone's confidence and their quality of life. But, kind of more specifically, I think I was lucky enough to be a minority that was practicing, and I didn't actually realize the value, or let's just say I underestimated the value of representation. And when I moved to Northern Virginia, I kind of just didn't think about it, but a lot of people who were skin of color, who were female, maybe women who wore hijab, which is like the head covering, they were starting to gravitate towards me. So they were flying in, they were driving, across states. And I was just kind of like, okay, they're coming to see me. And, at some point I was talking to other people at SOCS and they were like, no, actually, they're seeking you out because they think you will have a perspective that maybe, another dermatologist won't have. And Dr. Crystal Agu, who's very active in SOCS, and I were having a discussion one day, and I realized, gosh, I had, dozens and dozens of patients who were coming in for hair loss who also wore a scarf. And we ended up, collaborating on this case series for women who are experiencing hair loss with hijab. And I think before I really started talking to Dr. Agu about that, a little bit of me thought that was just everybody's experience. And then when she was like, no, no, this is unique, I realized, we really should put this out into the literature because these are, they're valuable tips that other dermatologists might not know. And so, yeah, I think that actually has been an unexpected reward for me.
Okay, great. Wow. Yeah, that's so interesting. It's so interesting to hear about how Dr. Agu came in contact with you and about how you guys kind of came together and she let you know that this was a topic that was really worth discussing.
Yeah, no, thank you. Yeah, it's actually been really yeah, it's been really great the collaboration that I found through SOCS. Not only with her, but I think a lot of the other physicians are just they're very eager to put information out into the world that maybe is filling a gap that, is really currently not being filled by anybody else.
Yeah, yeah, absolutely. No, it's something that yeah, we talk about all the time on this podcast, and I can tell you it's been eye-opening for me when I hear about it, when I learn about these kinds of things, because like you said, we're all in these different circumstances in life, and oftentimes we just don't know, and that goes for clinicians as well, right?
No, absolutely. Yeah.
hmm Well, okay, so I wanted to ask you then as well about challenges that you face.
I think I would say one of the biggest challenges that I am seeing just in my practice as a whole currently is just misinformation. So the problem I think now, especially with social media, is patients are much more informed, but they're not always accurately informed. And, although it's so easy to put derm stuff out onto social media, I will say that I think dermatology is one of the few fields where one size really doesn't fit all, right? So, like, for example, if we're talking about high blood pressure, we will often use a very similar class of medication across patients because our insides are more or less the same. But with skin, your skin type, your tone, your amount of sun exposure, that completely changes the way I treat a patient. And so I think what works on social media does not always translate. Like it's different from, hey, I love this candle, you're going to love it too. Like I love this cream may mean you're going to get acne with this cream. And so I think especially with younger people, a big part of my role I feel has been really helping guide them through what's evidence-based versus what's trending, but then also trying to tell them that this is what's right for you as an individual. And so that I think is currently a challenge just based on social media.
Absolutely. Have you been noticing, do you feel, because I know this is a topic that gets discussed a lot in dermatology, do you feel that some patients are better informed than maybe they had been prior to social media being so widespread? Or do you feel that it's kind of a double-edged sword of some people are better informed and the other people are way, way misinformed?
Yes, I mean, totally, right? Like nothing is ever black and white. So I feel like some people come in and they've got great information that, is a great starting point for me. And some people have gone down some weird rabbit hole of where, there's no science left in what they're coming in and saying. And those people, I feel like, gosh, like some of the things you have heard online are actually going to be harmful for you.
Yeah.
And no sunscreen is a big one, right? Like I really shouldn't wear sunscreen. Sunscreen is poison. Like especially with kind of my clinical interests, I see that a lot.
Okay, so speaking of your clinical interests, I'd love to hear a little bit more about them and kind of the big advances in those areas that you've been seeing since you began in practice.
Um, yeah, I love this topic. So, I think really my passion in dermatology is supplementation for health. And one of the things that really got me started in this was when I was working at the University of Utah. A lot of people don't realize, but Utah has the highest rate of skin cancer in America. And so I was seeing all these patients coming in, often young patients who were doing everything we told them to do, sunscreen, UPF shirts, hats, sunglasses. And they just kept coming in with, more stuff for me to remove. And they were frustrated. And I got a lot of what else can I do? What else can I do? Is there something I can eat? Is there something else I can do that could help me? And also, they were scared for their kids. Like, what can I do so my kids are not in the same situation? And so, I began kind of studying polypodium and all these other antioxidants for internal protection. And I always say I didn't really set out to make a vitamin. Like what I was doing was I was wanting to provide options for my patients. So I just kept delving deeper and deeper into what antioxidants are going to work. And when I finally kind of came out on the other end, I realized that what we really needed didn't exist. And so then I kind of set about making it. Like we worked on polypodium, which is the fern that's been used for thousands of years, even by tribes as internal sun protection. I worked on this kind of proprietary technology called polyleucora technology, which is a way to extract all of those antioxidants and polyphenols from the fern so that, as a doctor, I wanted to make sure I wasn't just like kind of grinding up a fern and giving it to my patients. I needed to take the most potent parts of it and make sure that it worked. So we created this technology and then we started doing a ton of research to make sure it really did protect our patients from the sun. And so, I'm happy to say we have this gummy format, which is the only clinically proven gummy for sun protection. And we have a lot of research behind it. And it can be given to kids, 3 and up. So that is, I think, what I spent a lot of my time on. And then relevant to SOCS, we also have a supplement called H Defense. And that one is specifically for melasma, which is a condition that a ton of women of color, kind of have to endure. And we just presented a study at the SOCS meeting ahead of the AAD just last month. And in that, what we showed was when people added this capsule, which was just full of antioxidants and anti-inflammatories for melasma, when they added it to their melasma treatments, both the patients and the physicians realized that those patients did better. They got less melasma and they improved their melasma a little faster.
Interesting. Yeah. Well, okay. So that actually brings me to another question that I wanted to ask you, because in patients with skin of color, where
Yeah,
concerns like you said, melasma and hyperpigmentation often outweigh skin cancer risk, how do
yeah.
you, just broadly speaking, approach photoprotection differently?
So, I think in a patient um, like with melasma, especially in skin of color, the approach to photoprotection for a long time was just kind of like, yep, it's the same thing. No matter what Fitzpatrick skin type you are, we're going to do it the same way. But I think it's fundamentally different, right? Because we're not just trying to prevent UV damage, we're preventing melanocyte activation. And so, I think visible light plays a major role here. And so I think now a lot of us really strongly emphasize tinted sunscreens with iron oxides, which will block the visible light. And I think that that's really important. But then in addition, I think these ingredients like polypodium, which we know can, decrease tyrosinase activity, which will lead to browning, or pycnogenol, which is it's a fern. I'm sorry, it's a bark that comes from a very specific forest in the south of France. And we notice that when patients who have melasma take that bark, they improve their melasma a lot faster. So, and green tea is another one that decreases oxidative stress. And so I found that in skin of color, my approach is definitely a lot more holistic because at the end of the day, it is much easier to prevent pigmentation than to try to undo it once it's already there. And I think that's a shift that we're experiencing that we didn't really talk about a lot. We were like, "Oh, you have pigment, let me treat it." And I think now we're starting to realize, hey, if we can decrease the amount of pigment by decreasing some of the UV stress on the cells, those patients are going to do better.
That's excellent. Yeah, it's interesting to
Yeah.
hear about the shift in conversation that has happened there.
Hmm. No,
Uh,
definitely.
yeah. Well, okay. So how do you counsel patients on combining topical sunscreens then with newer strategies like oral antioxidants, especially in terms of, safety, consistency, and then who benefits the most?
So, I always say that sunscreen is the number one thing, right? So, sunscreen is our approved way of protecting ourselves from the sun. And so, as a dermatologist, I never want someone to be like, oh, this is an alternative to sunscreen. It's not, but it is important to realize it's mechanistically different. So, we know that sunscreens, whether they're physical or chemical, they're kind of, trying to, they're like a filter, they're filtering the UV. Whereas when you're talking about antioxidants, they are working inside the cell to mop up or, repair some of the damage that has already gotten through. And so I think that concept is really important to explain to patients because the one thing I want them to know is, we always say this is sunscreen's best friend. It's not a replacement for sunscreen because I do want them to know it's an adjunct. And then as far as use, the beauty of polypodium is, our gummy, for example, has been tested in ages 3 and up. And we know that anyone who's 3 and up can take it. It's a fern, so it's herbal. It's very, very safe. And the safety profile is actually so excellent that we are giving it to kids in 4 or 5 times the recommended dose. Like, for example, if you have vitiligo or you have PMLE, we can give it to you. The dose is 280 milligrams. We can give you upwards of 1,000 milligrams very, very safely. And these kids, are having no side effects. I always laugh because I say my own niece took the whole bottle one time of the gummy because her dad wasn't watching her. And
Oh
fine.
no.
I know but I was like, the nice thing is it's an herb. It's like eating too much spinach. And so fortunately, she was totally okay and kind of served as a little, N of one for me to say, okay, good. It is, it is safe to take this in much higher doses. And then how do I counsel patients? I usually tell them, you want to take it 1 hour before you go outside. And knowing what the half life is, you can repeat it every 4 or 5 hours. So for most people, I say, use your sunscreen. And if you're using a chemical sunscreen, you have to put that on, 15, 20 minutes before, anyways. And so I say, put your sunscreen on, take your gummy. It works in about an hour. And then, re up or, take another dose if you're still out there in the sun 4 or 5 hours later.
Okay, and related to this topic as well, I wanted to ask you a little bit about internal photo protection because I know it was a hot topic this year at the AAD meeting. So, can you go into a little bit about what this actually means and how ingredients like polypodium leucotomos, I don't know if I'm saying that
Mhm.
right, work at a cellular level to protect the skin?
Yes. So I think, a lot of derms are using polypodium. And the nice thing about polypodium is that it's actually so potent that, as derms, there's three things, right, that we're trying to prevent when it comes to sun damage. We are trying to prevent sunburn and pigmentation. We're trying to prevent photoaging, and we're trying to prevent cancer. And I think the beauty of polypodium is that it has properties in it that protect us against all three. So what with the UV index being so high now and the temperature rising every year, I think we really are starting to, shift gears from just saying sunscreen alone to, hey, we've got this toolbox and there's multiple things in our sun protection armamentarium that we can be using. And so I noticed at the AAD this year, there was a definite switch to, being very intentional about layering antioxidants. So we used to kind of be like, okay, we know of all these antioxidants, let's throw them all at a person. And I think what the shift really was this year that I noticed in our conversations was, um, we know that sunscreen is kind of filtering the sun that's trying to get to the cell. Now, when the sun gets into a cell, we would love to be able to protect the cell membrane so it didn't get in. We'd love to be able to protect the cytoplasm, and then we would love to protect the DNA, right? So we don't get cancer. And so I think we're becoming very intentional about the antioxidants we choose. And the three that I really love talking about and I'm hearing more about is the combo of nicotinamide, which is proven to decrease non-melanoma skin cancers by acting in the nucleus, polypodium, which acts in the cytoplasm to decrease reactive oxygen species and immune dysregulation. And then, astaxanthin is kind of this up and coming ingredient. And the beauty of that is that astaxanthin is the only one that really can sit in the phospholipid bilayer. So it protects the cell membrane. And I think that was a shift where we kind of, really, I think as a group now in derm are starting to feel like, yes, we can't just pick any old antioxidant. They don't all work the same. We have to pick them based on where they're acting so that we can get a complementary profile.
That's interesting. Okay. Well, thank you for sharing that. Yeah, and now I want to switch gears a little bit to talk about something that is related to AAD, because I wanted to ask you about physician care and wellness and how, healthcare providers can build a sustainable self-care practice. And I know you moderated a very interesting panel about this at the recent SOCS Scientific Symposium, which happened during the same time as AAD. So, could we hear about some of the main takeaways from that discussion?
Yeah. So, there was this amazing panel of dermatologists for that. And I think that, knowing that physician burnout is at an all-time high, it was just so nice to see people who are really making it all work. And I think the biggest secret was they're not always making it all work, right? Like all of us are constantly a work in progress. But I think the most important thing that I learned from that discussion was that um, sustainability doesn't really come from these big aspirational changes. Like we always think it's going to be this big thing we have to do, but it really comes from these small systems that are just repeatable in our day. And so, for example, we talked a lot about the book Atomic Habits and
I've read
habit
it.
stacking. Did you read it? I loved it. I read it too. And so I think all of us in that panel talked a lot about habit stacking and whether or not we called it that or knew that was what it was, we all do it to some extent. And, so we talked about the fact that you can't like find time for wellness if you're already telling me that you're burned out, right? So what we need to do is we need to attach these wellness practices to things we're already doing. So we talked a lot about things like while you're making your coffee, do 5 squats, and attach those two things. Or every time you go, into your office to chart, do kind of a posture reset, take a deep breath. Or when you come home, change into your workout clothes instead of changing into your pajamas or whatever, just to force yourself. When you take away some of the friction, I think it makes some of these things that we want to do a lot easier. And so I think that that was a really good message that everybody conveyed in that panel. And then I think sleep just came up again and again as this high yield intervention. And I think many physicians are kind of functioning in this chronic sleep deficit, let's just call it. And we talked a lot about just putting simple guardrails into place. So, having a consistent wind down routine. And then the thing that we're all guilty of is like limiting late night screen exposure. Maybe picking one day a week where you can sleep in a little bit just to catch up. I think those were things that really came across as being very important to all of the physicians on the panel.
That's so interesting. Yeah, these are topics even not me as a physician, but even I think about a lot.
Yes. I mean, I think we're all kind of functioning in this chronic sleep deficit, right?
Yeah, right. And the screen time thing, to say the least, is an issue.
Huge. Yes. Yes.
Well, okay, great. That sounds so interesting. I wish I had made that talk, but I didn't, unfortunately. But well, speaking of holistic care, let's talk about the
Mhm.
important role of collaboration with colleagues outside of dermatology. So, what kinds of specialists do you consult with on behalf of your patients, and what would you say are the big takeaways from your exchanges with these other healthcare
Mm.
providers?
Um, I guess I would say in dermatology, we collaborate a lot more than people realize. And the reason is that, kind of my biggest takeaway is that the skin is actually a window into systemic disease. And so, because of that, if you collaborate earlier, I just think that patients are managed much more holistically. So I regularly work with rheumatologists for autoimmune disease, obviously oncologists because we see a lot of skin cancer, endocrinologists because hair loss and hormonal acne is often something that they can help with, and we work in partnership with them for that, and psychiatry because psychodermatology, body dysmorphic disorder is becoming, unfortunately something that's much more in the news, but also something I'm seeing a lot more in my office, probably because of social media. And so I just think we all become better physicians when we collaborate, right? They have knowledge that I will never have unless they teach it to me. And so I have found that that collaboration has been actually very vital to my ongoing education as well as kind of the care of the patient.
Yeah, I'd actually like to ask you a little bit more about that because you said
Mhm.
you've seen that a little bit more right now in your practice, and that does seem to be
Yes.
something that's very, prevalent on social media, at least from what I've observed. So, what are your thoughts on that? I mean, do you see it getting any better? What do you think?
I think social media is in the business of doing business. And what I mean by that is they're not really motivated to put checks and balances into place. And so um, I'm seeing more of, parents coming in. And this has definitely been a shift. Like it used to be almost like a status symbol if your child had a phone at an earlier age. And I'm seeing more and more parents kind of waiting it out. Like the evidence, especially my pediatric colleagues will, tell you that social media, the longer you can wait, the more healthy a child's development is. And I have 3 teenage daughters, and I will say I wait a long time, much longer than they like, to give them social media, just because in my office I'm seeing it. And it's, yes, maybe there's a little bit of like, I wish I had it, mom, but I think if I can give them a bit healthier development by delaying, I would like to do that. I'm seeing more and more patients, mothers especially, kind of leaning into that data.
Now I want to ask you a little bit about what you would like your colleagues in other specialties to better understand about the dermatologist perspective on health and well-being of the whole patient, like you were mentioning earlier.
Um, okay. So I think the biggest thing that I would want people to know is that despite what we see kind of around us, dermatology is not just surface level. The skin is often a reflection of what's happening internally. So, whether that's inflammation or oxidative stress or hormonal shifts, or even stress, like, I often feel like we can see stress on the skin. And so, I do spend a lot of time thinking about the whole patient. And I talk to them about their diet, their lifestyle, what's going on in their life from a stress perspective. So, I think what I, really, would want people to know is that it's not an either or, like it's not a topical or an internal. I really do think we do the best care when we combine. And I know people come to me to treat the surface, but I'm a very strong believer in improving the skin from within, which is actually why I named my company Inner Glow, because I really feel like, when you feel better, it shows. And so that is something that I believe, sometimes people don't really realize about dermatology.
Yeah, yeah, that's interesting. I definitely think the interplay between the inner versus the outer is
Mhm.
something that doesn't get maybe discussed enough in the dermatology field.
Right. And I think time is short. We're all pressed for time, and so we want to solve the problem. And sometimes that deeper discussion, unfortunately, there isn't time for that.
Yeah, yeah, absolutely. Well, okay, so now I want to shift gears a little bit as well and ask you a little bit about your experiences with SOCS, with Skin of Color Society. So, what have you gained, would you say, by belonging to this organization? I know you're active at SOCS scientific meetings, so could you
Mhm.
tell us a little bit about, yeah, the rewards of serving in your capacity?
Yes. So I have Dr. Nada Al-Book to thank for that because I was on the Virginia Scientific Committee and she kind of was like, hey, this is a great thing to do at SOCS. And I was kind of looking to get involved, wasn't, sure how to. So this has actually been a very meaningful way for me to be involved in the society. And, I will say it's a community really that is committed to advancing representation, which is obvious, but really also representing science, representing just science and the advancement of science, which um, I think is a perspective that I gained after joining. So, serving on the scientific meetings committee, you get a front row seat to the research pipeline. And you're surrounded by all these peers, right, who are pushing the field forward, especially with respect to topics that have been historically underrepresented. And so I think I just have loved being a part of something that's not only advancing the field, but also, let's say, shaping who gets to be represented within it. I think that's been a very beautiful part of being in SOCS.
That's amazing. Okay, great. Thanks for sharing that. Now, I want to close out our discussion here with your favorite pearl of wisdom that you would choose to inspire your colleagues. So, could you just share with us a thought that you would say has been meaningful to you?
Um, okay, I think that I love the saying, you can't pour from an empty cup.
Mm.
And it probably took me a decade or more in dermatology to really realize that um, I had to learn how to protect my time and my energy because, if you don't take care of yourself, you actually are not as effective at taking care of others.
Well, thank you for sharing that, Dr. Galaria. I appreciate your time here with us today. I know that we have to go now, but yeah, it's been a really interesting and insightful discussion. So, thank you so much.
Thank you for having me. It was great.
Yeah, absolutely. And thank you to our listeners for staying with us today. We hope you found today's episode enlightening as always. If you're interested in learning more about the work of the Skin of Color Society, please visit skinofcolorsociety.org. And don't forget to subscribe to HCP Live's newsletters, follow us on social media, staying up to date on all the latest in dermatology and more. And we will be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. And until next time, thanks for listening.